Thank you, Sharon, and good morning, everyone. It's nice to see a room full of bright faces this morning. As you know, the theme of this year's forum is community collaboration. So I'd like to take a few minutes to talk about collaboration and the links between collaboration and health equity, because that ultimately is our broad goal in the work that we do here in the department and across our collaborations. It works. Collaboration, put simply, means to work together. If we collaborate with one another, we can reach goals that cannot be achieved by any one of us or any one organization. We can better explore different aspects of a problem or an issue through collaboration, bringing together multiple and diverse perspectives. We can explore differences, both within our populations and within our organizations and within our systems, and bring those differences to the fore and use and value those differences in our collaborations. And in our collaborations, we want to be able to use the expertise, the resources that everyone can bring to the table in those collaborations, including community perspectives, which are often most reflective of the needs in communities and the resources in communities, which we really need to be in touch with to be an effective system. Collaboration can provide all kinds of benefits: structures for organizing, for planning, and implementing ideas. It can provide and involve diverse and non-traditional partners that we might not think about in our everyday work. So we really need to be looking for those unusual suspects, if you will, who can bring new perspectives to the work that we do. Collaborations provide opportunities for learning for everyone. I'd like to say that every day is a learning day, and in collaborations, we learn lots from each other. Collaborations help to build trust and mutual respect. Trust and respect are not things that can be demanded, they must be earned. And so as we work together, we earn trust and we earn respect from one another. Collaboration brings to our work more horizontal governance. Many of our formal structures are very hierarchically and vertically structured. With collaboration, we break down that structure a little bit to allow for more horizontal governance and for distributed leadership. We all have a leader in us. Collaborations help that leadership to come to the fore. And one of the things I really like about collaboration is that they tend to be a bit more informal than our typical formal structures. So the communication is more personal, the communication is more conversational, and it's more exploratory. We often bring to collaboration the spirit of inquiry and innovation, which is really important in the context of an evolving health system to be innovative and to be curious about what we can do more of and what we can do better to support communities. This is a rather elaborate graphic that looks at the continuum of collaboration. You have a copy of this on your tables, and there's a copy of this over on that wall. We're going to use this depiction of collaboration in our conversations later on this morning. So suffice to say at this time that turf and trust are essential elements of collaboration. And the extent to which we can let go a little bit of the turf and expand the dimension of trust in our relationships, our collaborations will be more meaningful and more beneficial. We shall delve, as I said, much more into this later on this morning in our conversations. Turf is around issues of control, and in collaborations, we try to break down that control, or at least share that control in terms of sharing resources, sharing responsibilities, sharing successes. Trust, as I said, takes time. It means understanding each other's roles, each other's needs, each other's perspectives, and appreciating and working with diversity within our collaborations. So we need to build capacity for collaboration. We certainly have some capacity within our systems for collaboration, but we can build on and enhance that by all means. We can help to build more effective work processes so that we can collaborate more beneficially with one another. We need to create supportive environments and inclusive environments that let us get to know one another and to bring everyone into the conversation. As I said, collaboration is a process of continuous learning, and that is a really important part, I think, of the work that we do together. Collaboration occurs at different levels, so we need to look at collaboration within and across organizations, systems, and individuals, and we can build capacity in each of those realms in the work that we do. We are building our mutual knowledge, We are building our mutual learning, and we are building our expertise as collaborators as we engage in work with one another. It's important for us to evaluate those collaborations, to learn from them, and to celebrate those collaborations for the benefits that they bring to our work. So in terms of the links between collaboration and equity, we know that inequity is rising across the world, really, and certainly in our nation and in our province. We are kind of in the middle of a paradigm shift where we're moving from more acute care to the knowledge that we need to do a lot more on the prevention side and a lot more in community-based service and community-based orientation in our work. Collaboration can help to reduce barriers in care, which are a result of inequities not only in the health system, but across our systems, in economic systems, in our social systems. So when we collaborate, we can help to reduce the impacts of those inequities on our population. When we collaborate, we can help to make services more equitable. We can make them more culturally relevant. We can make them more accessible to populations who are often marginalized in our formal systems. And it's really important for us to do that in order to address, or at least mitigate, the impacts of the inequities that we are seeing in our systems. And ultimately, when we collaborate, we are seeking change in the environments and the conditions that underlie health. Again, those social and economic inequities that through our conversations, through our collaborations, and through advocacy in the larger system, we can try to change to create more equitable conditions for everyone. So I hope you will keep those points in mind and the many others that I know you bring to our conversations from your own experiences and from the presentations and panels that we'll hear today. And I'd like to turn it over now to Kirsten, who's going to introduce the speaker program, the first speaker in our program this morning.